Hey everyone, welcome back to Med Simplified. I am absolutely pumped to guide you through today's explainer. We're diving into a high-yield, super fast-paced review of the human skull. Look, if you're a med student gearing up for your board exams or your anatomy practicals, you are literally in the perfect place. So let's just jump right in. Think about this for a second. How did 22 distinct bones fuse together perfectly to protect our most vital organ? It's just an incredible piece of biological engineering. Mastering how these bony plates, these sutures, and these landmarks all interact, well, that's an absolute must for crushing your exams and, eventually, surviving your trauma rotations. Okay, here is our syllabus for today's review. First, the axial foundation. Second, cranial bones and articulations. Third, the facial skeleton and landmarks. Fourth, cranial sutures and fontanelles. And finally, number 5, sinuses and skull function. Section 1. The axial foundation. So let's set the stage. The axial skeleton is the central bony core of your entire body. And the skull? Well, the skull is the ultimate capstone of this whole system. It sits right up there on the upper end of the vertebral column. You've kind of got to stop picturing the skull as just this isolated floating helmet and start seeing it as the structural anchor for our entire central axis. Now, structurally, we can break the skull down into 2 totally distinct functional parts. Up top, you've got the cranium, or the brain case, which creates this incredibly tough protective vault for the brain. And then down below that, you've got the complex architecture of the facial skeleton. Moving right along to Section 2, cranial bones and articulations. All right, let's talk about the major players of the cranium. We've got the large frontal bone right up front, the huge parietal bones forming the roof, the temporal bones on the sides, and the occipital bone wrapping around the back. And what's really cool is how these flat, irregular bones interlock like a giant jigsaw puzzle. Those jagged connecting lines, those are your sutures, and they act as completely immovable joints once the skull is fully mature. Now, understanding exactly how these bones connect is absolutely crucial. Seriously, take a quick screenshot of this slide right now. This bulleted summary of cranial bone articulations is super high yield, and I guarantee you're going to see it on your practicals. Just remember the basics. Your parietals articulate with pretty much everything on top. The occipital bone has those all-important condyles linking up with the atlas, or C1, so you can physically nod your head. The sphenoid, that's your internal crossbrace for the whole setup. And the temporals connect to a bunch of different bones, including the mandible. And speaking of the sphenoid, it truly acts as the keystone of the cranium. It's tucked right into the middle of the skull base, essentially locking the cranial and facial bones together. Oh, and for your board prep, do not forget that saddle-shaped depression right in the middle of its superior surface. That's the hypophyseal fossa, and its one big job is to safely cradle the pituitary gland. If we flip things over and look at the base of the occipital bone, your eyes should immediately go to that massive opening right in the center. That's the foramen magnum, literally the great hole. It's exactly where your spinal cord exits the brain and travels down into the cervical spine. And right flanking it are those articular condyles we just talked about, which let you do that yes-nodding motion. Section 3, facial skeleton and landmarks. Okay, so the facial skeleton is made up of 13 distinct bones, plus that frontal bone we already looked at. Let's do a really rapid-fire tour of the anterior landmarks. You've got your 2 prominent zygomatic bones. Those are your cheekbones. You've got the maxilla, forming your upper jaw, the roof of your mouth, and holding all your upper teeth. And right dead center, you'll spot the delicate nasal bones, making up the bridge of the nose, sitting right next to the tiny lacrimal bones on the inner walls of the eye sockets. Now for the lower jaw, the mandible. You know what makes a mandible so unique? It is literally the only movable bone in the entire skull. If you trace the ramus projecting upward, it splits into 2 processes at the top. The one toward the back is the condylar process. Mark this down, it's super high yield. This specific process articulates directly with the temporal bone to form your temporal mandibular joint, or TMJ. Section 4, cranial sutures and fontanelles. Let's talk development, because the skull changes a lot from birth. Here we're comparing adult sutures with neonatal fontanelles. On the adult side, you have these rigid, completely immovable joints between fully ossified bones. But newborns, their ossification isn't finished yet. They have fontanelles, which are these flexible, membranous soft spots where 3 or more bones meet. Why? Well, the bones can't fuse early because they actually need to shift and mold so the baby's head can safely pass through the birth canal. You can see this brilliantly on an infant's skull. The most obvious landmark is that massive, cross-shaped area right on the top. That's the anterior fontanelle. Clinically speaking, you absolutely need to know this. That large membranous area doesn't fully ossify until the child is around 12 to 18 months old. For pediatricians, it's basically a literal window right into the cranial vault. So, how does this all build into the mature adult skull? Well, once ossification finishes, those soft membranous gaps transform into the tough, jagged, interlocking lines we mentioned earlier. For your practicals, you've got to be able to trace them. You have the sagittal suture running straight down the midline between the two parietal bones, the coronal suture, separating the frontal bone from the parietals, and finally the lambdoid suture in the back, separating the parietals from the occipital bone.
Section 5. Sinuses and skull function.
Okay, let's wrap things up with sinuses. By definition, sinuses are these air-filled cavities tucked inside several facial and cranial bones, and they're lined with a ciliated mucous membrane. But as a med student, you need to know the why behind them. Sure, they add resonance to your voice, but here is the huge functional takeaway I want to hammer home today on Med Simplified. These pockets drastically reduce the overall weight of the skull. Seriously, if your skull was solid bone, it would be impossibly heavy, causing massive neck fatigue. These air pockets are basically nature's way of making our heads light enough for our spine to actually support. And we can map out exactly where these brilliant weight-saving air cells are hiding. You've got the frontal sinuses up in the forehead area, the ethmoid air cells squeezed right between the eyes, the sphenoid sinuses sitting a little deeper back in the skull base, and the massive maxillary sinuses taking up a huge chunk of your cheeks. And don't forget, every single one of these communicates directly with the nasal cavity. So, bringing this all together, the skull is way more than just a simple bone helmet. Its functions are amazingly complex. The cranium is the ultimate protective vault for your brain. The bony sockets shield your eyes while giving your eye muscles a strong place to anchor. Deep inside that temporal bone, you've got the incredibly delicate organs for hearing and balance locked away safely. And of course, the maxilla and mandible give us those essential alveolar ridges to hold our teeth securely in place. We have covered a ton of high-yield anatomy today, but I want to leave you with one final provocative thought before we go. You've mastered the textbook anatomy, right? You know the sutures, the articulations, the sinuses, but how will these exact landmarks guide your hands when you're evaluating a real crashing patient in a chaotic trauma bay? Keep that real-world clinical application in the back of your mind every single time you study. Thank you so much for learning with me today. Keep crushing that board prep, and I will see you in the next explainer.